Welcome back. This is a follow-up to our webinar last week that we did on Workplace Re-Entry. It was a great discussion. We covered a lot of ground and really didn't have enough time to address all the issues. We certainly didn't have enough time to address all the questions that came from the group. So we thought what we would do is today, spend about 30 minutes and address some of those questions that came in online. So if you didn't catch the original webinar, it's included with this package, so go back and watch that. We've got most of the panel back together. There's a couple that will get added into this live discussion. But just to quickly catch everybody up on the panel, especially for those of you who didn't catch the original webinar, we've got Lee Harrelson with CMTA CMTA Engineers. We've got Tamara Van Meter with SMBW Architects. We've got Chris Durand with DPR Construction. We've got Kimberly Smith with Knoll Furniture. And then also addressing some of the questions will be Ginny Johnston of Capital One and Stephen Jayjock with JLL. So thank you guys for joining us and addressing some of these questions. I think I'll start off the question that was posed a lot during the webinar last week. And I think we've all talked about that we're getting a lot from peer groups. We've had a lot of discussions. Everyone is gearing up to welcome people back to the office. And I think, everyone's a little, kind of a little unsure and trying to gauge about when. So what is the date? What's the best time? So the first question, I'll pose it for everyone, just at a high level. You don't have to get in the weeds, but just kind of thinking about big picture plan. When are you planning to welcome employees back into your workspace? So why don't we start with you, Tamara?
Sure. So as you guys know, Spencer and I are partners. We have a 20-person firm. So we think are definitely on the small business end of the spectrum. What we have talked about doing is really following the governor's guidelines. So we're looking at that phase 2 reentry date. Right now it's June 10, even though there's a upward tick in cases, we're watching that pretty closely. So we're looking at doing a voluntary reopening around mid-June. And we're probably going to stay in that pattern for about a month. And then we're going to be watching when we go back to phase 3. So that is how we're going to do it. We are using shifts. So the office, we're trying to kind of take the capacity of people in the office down to about 50%. But again, we just want to stress it's going to be optional. We have done some polling of our staff. We did an in-depth survey about 3 weeks ago. We redid the survey actually yesterday to see if people's temperaments have changed. And I would say for us, it's about a 60% ready to come back, provided things are, safety measures are taken, and 40% are not ready yet. So we've done a lot of conversations with some of our peer firms, and I think our schedule sounds pretty consistent with how a lot of particularly in the design and construction fields, a lot of companies are looking at a slow, gradual opening starting soon.
All right, that's maybe a small firm perspective. Chris, how about you guys? What are you guys doing locally, maybe, and even is it the same nationally?
Really, from an office standpoint, we've got close to 30 offices around the country in 14, 15 different states. So, we have to comply with the local jurisdictions, the municipalities that we're in, but we're also really just trying to be cognizant of the employees themselves. And, to some of the points of the other panelists is really opening the office safely with the proper protocol. But for those employees that want to come back to the office, because over the past 3 months, we've really proven that much of our admin staff can work remotely. As far as construction sites, it really goes project to project and customer to customer as well. There are certain customers that would like to see a full force mobilized again on site. There's others that are kind of treating it similar to the way we're treating our office. Remobilization is on an as-needed basis, so long as the employee is, feels like they're in a safe environment.
Okay. Ginny, how about you guys at Capital One?
We've outlined a slow and steady phased return. And it's while remaining cognizant that this pandemic may shift up or down, and we need to remain nimble to that. So we view return in the short and long term approach, that our short term is really going to be percentage based. It's not going to bring our full workforce back. And so we're looking at staffing strategies that we can use to support that percentage based, whether they be steady groups or shift work by day or by week. Then we're looking at who are those individuals or teams that aren't being supported, that need to be supported in the office. But we're really supporting through virtual collaboration, and it's going to be a must as we re-enter the workforce. So right now we're supporting essential associates only, and our businesses are exploring the who of that. A voluntary approach is one that's being explored throughout the industry as well as us. And at the end of the day, our associates will decide their readiness to come back based on their unique situation.
Okay, thank you. Lee, what are you guys doing at CMTA?
Well, so CMTA has 13 offices across mostly the eastern half of the United States. And it's been a little bit different depending on which office you ask. I think our Charlotte office has already actually gone back to an optional schedule, but most of the folks I believe are back in the office. Here in Richmond and also in DC, we're planning probably a late June or an early July reentry. Throughout this time, we've had several people working from the office already, spread out significantly. But I think that's kind of the timeline that we're working with. Boston is working with about the same timeline as well. I think what's been challenging for us is that, we're doing pretty well from home, but we value all of the sort of trust and relationships that you get from face-to-face work. And so right now we're kind of in that survey phase where we're really just trying to gauge everybody's interest and hopefully get enough data on what this the reaction is to loosening up social distancing restrictions, to see if that informs our decision at all throughout the month of June.
Okay, thanks. Kim, Knoll?
So at Knoll, we are actually, for our own employee perspective and understanding the expressed worries or concerns of our employees, we did an employee survey to see who was ready from an assessment perspective to return to work, and then created a document that we shared with all of our associates that's called Improving the Way We Work Now. So the Knoll constellation of brands got a guide about returning to the workplace when the time is right. We really have had a great opportunity from our leaders and great empathy. So they've been really empathetic around everyone's personal need and the commitment to our health and safety, and then understanding some of the strategies and fixes that we might have in the showroom space itself. And also broadening that to understanding the workplace life, working together, how to do that. And then this great section of our etiquette guide, if you will, of a healthy advice, or advice for a healthy workplace. So the added value, or the added complexity, I should say, for Knoll is that we are a showroom that hosts visitors. So each visitor is expected to comply with our building first, because we're usually in leased spaces in our showrooms in cities, whatever the landlord's rules are. So if the landlord is requiring masks, we're asking them to do that. And also on any showroom tours, our employees, a little bit to what Tamara said about, when you're mobile, wear a mask. We're sort of following that, respect policy so that we can continue to contain the virus.
Okay, thanks. Stephen, JLL, again, you guys are international, really. Talk a little bit about maybe what you're doing here in Richmond. I'd also be interested to know if it's a one size fits all, or if, you know, like DPR, you're really tailoring it to the locale.
We're actively planning our reentry into our space, at least phase one of our reentry, which will be limited in capacity and will be in 2 groups, and will be separated by Group A and Group B, which will have its own associated week to return to the office. In terms of the rules and regulations, those are things that are obviously constantly changing week by week, but for the most part, we'll observe all social distancing and minimizing the usage of common areas. So it's more the ability to return to the office and use the office components than it is the social aspect.
So here's a question that I think, you know, a lot of people are talking about, and this is really for Tamara, but once people come back, what is going to be the mask wearing protocol at SMBW?
This lot of conversation about masks. So what we are doing is, and I borrowed this phrase from somebody, but we're masking when mobile. So we are going to ask people, when you're up and moving around the office, going to the restrooms, corridors, things like that, that you wear a mask. When you are seated at your desk, you can take that mask off. But to Kim's point, when we do have folks come back, we're doing something similar. You're really only, if you choose to come back, you're only going to be with your team. So it's already a reduced capacity in the office, and those people are spaced out. So when people are at their desks, they're certainly meeting or far exceeding that 6-foot spacing protocol. So we're going to let them take their masks off at their desks.
Okay. Here's a question for Lee. You actually, I think the HVAC discussion generated a lot of interest, and I think there's been a lot of focus on that as maybe as a potential risk factor in spaces, and there's a lot of unknown around that. So there's a lot of questions, but the first one is, how much risk is there to having employees come together in an office from an airflow HVAC perspective, even with social distancing and mask wearing? So how much risk do you see in the systems in your space? I think is the question.
Well, I think it's definitely a difficult question to answer at this point, because we don't have enough data to say with certainty, and obviously the consequences of a wrong answer here are could be fatal, really. I can say this. ASHRAE has issued a couple of statements about this topic, and they've said that transmission of COVID through the air is sufficiently likely that airborne exposure to the virus should be controlled. So they believe it's possible. And they've also said that changes to building operations and the way that HVAC systems operate can significantly reduce airborne exposure. So personally, for what I'm hearing, the combination of mitigations that most folks are talking about in an office space, the masking while mobile, makes this risk a manageable one to re-enter the office. I think I feel comfortable enough to do that. How big is that risk, though? Very difficult to say.
Okay. All right. Well, I think everyone feels the uncertainty of not knowing exactly what all the risk factors are. I mean, we learn, as we talked about in the webinar, we learn more every day about transmission and where the real risks lie. Here's something for Stephen. I think a lot of people have been asking this question, but how are companies and landlords with multi-level buildings handling the challenges associated with vertical transportation? And second part of the question, are you seeing a decline in rent premiums for high floor tenants?
That's a great question. For the most part, all tenants are requested to respect social distancing. This is an individual request. So, there will be floor-way signage and directional arrows to assist in mobility in typically crowded areas. But they're, at this point, asking folks to take social responsibilities to provide the social distancing required in these areas. No, there have not been any changes to the real estate metrics. And I would say that, for the most part, I don't expect there to be any changes based on the floor level.
All right, thank you, Stephen. So while we're talking about workspace, let's go back to Kim real quick. There was a question here about kind of workspace reconfiguration. And we touched on this a little bit in the webinar, but the question is, do you see companies looking to spend money to reconfigure their workstations to further separate people or add height to panels? And really the second part is this a realistic solution? You probably can do it, but maybe is it realistic and is it valuable? Maybe is what people really want to know.
Sure. It's a great question. And I think it depends greatly on the customer, how the office is actually planned from a planning perspective, and whether or not it's really going to give you a long-term solution for this. Many companies, because of the expressed concerns about people just not feeling good about coming back to work initially, like Tamara shared the percentage for SMBW at, a little less than half of your own employees that are ready to come back, that the idea of staggering workspace as opposed to completely reconfiguring or breaking it down and redoing planning, people have been really evaluating their exact layout and seeing whether or not distancing can be accomplished in different ways. So to answer the question is, people are definitely looking at their workspace as a whole or holistically, not exactly just to the workstations. So that's been a big part of the work that we've been doing in the workplace strategy and research team, is really understanding the expressed concern of the employees and attaching that to the right solution for a return to work strategy.
Okay.
I could tag on to that question. Something that we're being asked a lot, so I'd love to hear your perspective on, is if I am going to, if I'm going to invest in screens, what is the minimal height? Because certainly there's everything from, slight modesty, visual privacy, standing privacy. So is there any research or anything that points to a minimal height that people should invest in?
Yeah, so that's a great question, Tamara. It's so new. The pandemic is so new that there's not research per se. There is a notion around providing seated privacy. So if you're at the seated position and let's say your desk is, 28 to 30 inches high, that the thought is, anything 12 inches or higher will give them a little bit more seated privacy. So you might not be able to see over a horizon there, but truth be told, a lot of our customers are looking a little higher than that, because obviously you have a variation in people's heights at a seated position. So they are looking at a little bit higher than that in some cases. But there's no prescribed height around COVID-19.
All right, so here's an interesting question. I don't know if there's really an answer to it, but it came from someone at UVA talking about, again, layouts of office and HVAC. And the question is, could you identify problem areas by overlaying furniture layout with an airflow diagram? How can occupancy and use respond to this? And it's almost like Lee thinking about microclimates. I mean, what is happening in 6x8 cubicle space with airflow?
Right. Yeah. So I personally believe that this is a difficult thing to do for all cases. However, I'll give an example. When we design hospital operating rooms, the way that they are designed, we have a laminar flow of air down from the ceiling directly onto the patient table. That then sweeps across the floor to low wall floor returns so that the contaminated air goes directly out of the space, doesn't get recirculated back up and then re-entrained in the breathing zone or into the patient. That's an ideal scenario. Now we're trying to take that same philosophy of how do we do this in an office space or a workplace, right? And, you know, you can't draw the same parallels because we can't do the same things in an office space necessarily that we can do in a hospital. They're not built that way, or they can't be readily modified. Still, I feel like there's some value in looking at where are the supplies, where are the returns, so we can kind of get an idea of where the air might be flowing. And then, you know, you could potentially even smoke test that to take a look at that. Actually put a tracer in the air and see where the air is flowing. And there may be some value in that in limited cases, but I don't know that we would be prepared to make the changes to the design that would be required to truly benefit the space and design it, you know, like an operating room.
So I'm curious, as a follow-up to that, if I was in a space that was built with access floor and my air supply was underfloor and my return was up at the ceiling, would I have really the same benefit, just in opposite direction?
Yeah, I think there are some systems that are going to work better for this than others. So a typical overhead system is going to supply the air down. It's going to mix significantly after it's breathed, and it's going to go back up to a ceiling return. When you look at raised floor air distribution systems, one of the benefits of those is that air that is breathed, you know, clean air comes from below, it's breathed, and then it goes up and out, and it's filtered at the HVAC system. You know, displacement ventilation, another sort of example of low on the floor and then up and out. Those are more effective systems from a ventilation standpoint, just for a normal space, not even talking about infection control, but it does a lot for this infection control idea too, because it creates a more predictable, I'll say, flow of air up and away from the breathing zone.
Okay, all right, thanks. Question for Ginny, which I thought was an interesting one. If you allow work from home, do you have requirements on employees to provide a certain minimum workspace and equipment, or are you financially supporting additional expenditures to equip them at home? So I guess how is Capital One supporting the transport of the workspace home, and who's responsible to make sure it's on par with what they would have at the office?
Yeah, we do not require our associates by any means to provide a minimum setup. We've provided tools to them to be able to work remotely, and we did that for the most part within the first 2 weeks. But we absolutely want everyone to be successful and work effectively in the office or in their home office. Ergonomics seems to be a biggest concern. I think we've heard a lot of associates, as well as within the industry, that kind of lacks when you start to meet at your dining room table, you're working from dining rooms or kitchen tables, or even a living room sofa. Not everyone has a home office, so it looks different for everyone. And we're encouraging our associates that if they have concerns, and need to be supported in different ways, to have those conversations with their managers, so that we really can support them as they work from home.
All right, thank you, Jenny. Let's pivot over to construction. You know, one of the conversations we've been having a lot here in the office, Chris, is we have several projects that are just starting construction, which we're very happy about, and happy that construction has been continuing on in this process. But the question is, how are you handling site visits to your sites, and what considerations for industry partners are you making at job sites for OAC meetings, things like that?
That's a great question, Spencer. Similar to the way we're handling, you know, remobilization to our offices, we really have to look at it state by state. municipality by municipality, as well as each client kind of has their own requirements. But specific to Facebook, since we talked about it earlier as an example, we've gone through a complete reorientation process with all of the employees and partners that come out on site, which includes the issuance of a new badge that has an RFID device on it. Allows us to track the number of employee on site, really allows us to understand space management, and then expect that we will reorient our industry partners to gain access to the site as needed. We're really evaluating additional RF tracking measures, additional manpower to temperature scan folks coming on site. So we really feel that many of these measures will be required to scale up craft and the folks on site, but also the additional access points, and will allow us to really help expedite getting folks back on site, including our trade partners and consultants.
Okay, thanks. I know we've had discussions at SMBW thinking about our protocols for what we're going to have in the office, but also starting to think about how do we marry those up with our contracting partners for site visits. And so I imagine there's going to be a lot of discussions with your different partners about, what is the overlap and where are people different, and everyone's got to adjust a little bit to get people on-site meetings, because one of the things we've discussed is that some of those meetings are really critical to be on site. There's certain points of construction that you just can't do virtually. So
Exactly.
Thinking about that, and we've talked a lot about how to get people back in and how to mitigate risk, but there's a question here about what is the responsibility of the employee in terms of monitoring their health and sharing that with the office. So a question for Tamara: what rules have you established for individual health monitoring? Is it an honor system? Are you going to take people's temperatures? How do you want employees to share? And what's the level at which they need to raise their hand and report an illness? Now, how's that going to work at SMBW?
Well, I'll answer it first for SMBW, again, kind of through the lens of a small business. But then I'll share what I've heard other clients are doing at different scales. We are doing an honor system. We're asking employees daily to monitor their health at home. And if they have a temperature that is higher than 100.3, that they not come in. Certainly if they have any symptoms or start to not feel well, now's the time to be overly cautious, and please stay home. So that is how we're proceeding. Other companies are, I've heard everything from people that are providing thermometer check stations when you arrive, either at the parking lot for really large campuses or inside the office lobby. Certainly there's another technology kind of application. You can do this at home and then record and upload through Outlook your daily temperature. So I think some companies who are, I guess, wanting to keep a log or to track it, there's certainly those options. We are not. We are doing an honor system.
All right. Well, thank you for that. Real quick, I want to get to a little bit of workplace stuff, but this question came in. I'll throw it to you, Lee. It's a little out of order, I guess, but you talked about this. You mentioned it in the webinar last week, and I think it caught some people's interest about the level of humidity in the office and how that might affect the risk or maybe the transmission viability of the virus. Can you speak to that a little bit?
Sure. Yeah. So the ideal humidity range, which has been established through a pretty good amount of research, I guess, is 40 to 60% relative humidity. When we go below that, what tends to happen is small respiratory droplets that are emitted when we talk or cough can evaporate slightly. They can aerosolize. And when they're really small and they're aerosolized, they can float throughout the air more readily. If we go too high, then there's a potential for other bacteria to grow. And so that's why that kind of 40 to 60% range exists. There's some other benefits too. when we have that kind of ideal humidity range, it's easiest on our respiratory system. So we're less prone to infection. And also, for whatever reason, I don't even know if doctors know this yet, but this is why the flu virus is thought to, subside in the summer, is that these viruses tend to be less strong or less virulent during ideal humidity conditions, and so that's thought to benefit the spread of it as well.
So it's kind of a follow-up to that. If I've got a humidity meter and figured out what the humidity level was in my office, and it wasn't in that ideal range, is that something that I could get a landlord to adjust?
So, unless your building is equipped with humidity control, it's going to be difficult to do that. Now, luckily, there are a lot of options. Some buildings do have humidification systems. Those can be adjusted. Personal sort of room scale humidification systems could be used in your leased space. That's another option. Sometimes there are sequences of operation on the existing systems that are just not enabled because of an energy savings requirement. And so those are things that I think you would have to engage your landlord or your facilities management team to really understand what the possibilities are and figure out what to do from there. In the summer, it's not going to be an issue. It's just once we start getting back in the winter and it gets really cold outside, that's when we'll see indoor space relative humidity drop below that range.
Okay. All right, thank you. All right, there's a lot of questions around kind of different occupancy. So when you're up away from your desk, different scales of spaces. So I'm going to kind of pose these to different people in the group, and it really runs through how we're going to monitor, how we're going to arrange those spaces in light of the COVID. So starting, I guess, really with Stephen, the question is, any rules for limiting occupancy of hall restrooms? And I think what they mean is if you're in a high rise or just a multi-tenant building, core restrooms. Is there going to be a limit on occupancy? Is there going to be, are there cleaning protocols or things going on to keep those in use?
That's a very good question. I can't speak for JLL. We are in a unique position in our building, but for some of the other buildings that we represent tenants in or we represent as a whole from a property management standpoint, again, social responsibility. I think that all tenants are being asked to respect social distancing and personal health safety. So to that end, there are some regulations that have been asked for wearing masks whenever you're in a public space, but I have not seen any mandate to limiting occupancy to a hall restroom. I think we're all adults and we should be able to respect the other folks and other people's social distancing needs and make the right call.
Let's go to Tamara, really, because I know in our office we've had a lot of discussions about this, but it's really around conference rooms. So the question is, are you making conference rooms in similar spaces with reduced max occupancy? So how are you rescaling space, I guess?
Yes, we definitely are. I think we've gone through and really reduced seating and re-spaced the furniture. We've also had to take a look not only at limiting occupancy and with that comes, I would highly suggest you also, do you hear those downtown Richmond trains? I would also encourage you guys to post signage that talks about the new occupancy for that room. And coupled with that, in some of your higher use spaces have cleaning stations. So it encourages people to really think before they walk into these rooms so they understand what's different.
Projects currently in design still have the same business needs. And I think, that it's important to note that we are still, in the middle of a pandemic and looking to slowly ease back into office space. So conference rooms and collaboration still remain to be very important components to business. And they are being planned into new design and new construction. And we do understand that they may be underutilized for the short term, but they're fully expected to remain an essential part of business long term.
The second thing with conference rooms is looking at how the AV packages are set up. Personally speaking, we're in the midst right now of converting all of our meeting rooms at SMBW to virtual conference rooms. We realized we've had some folks in the office working this whole time, very few, but you realize after propping your laptop up on books and fumbling with webcams that, this is not going to go away for a while. So we're investing right now in retrofitting the AV packages in our rooms.
I think that's a great point, Spencer. I just want to add something to Tamara's comment about that. There will be, for the unforeseeable future, a hybrid model of people that are remote as well as in space. So looking at conference space from that lens of adapting technology is really important to understand that hybrid model. And then to further emphasize what you said at the start about communicating differences. So people are creatures of habit. They'll go back into their old office, do the same things. So you need to really be sure to communicate the new policies and procedures that are going to, even if they're going to be temporary, you have to make sure that you're communicating that. We found that we were saying that over and over again to our customers. So we modified an etiquette guide that is exactly for this, re-entry plan for etiquette, including temporary signage ideas.
Okay, great. Well, so Kim, while I've got you, let me address this question to you. So what are companies with open floor plans doing to address distancing? Did you see the usage of clear plexiglass dividers between desks as a solution for open workspace like we see in many stores? And I guess another way to think about that question is emptying out every other seat to get distancing. Is that a better solution than keeping everyone in their seats and adding dividers?
Yeah, so Spencer, it really depends on the work that you're supporting and if the team approach works, and you can divvy up your workspace according to the teams that should be on site together. It just becomes a little bit more complex in that way, but lots of people are doing a checkerboard approach or an A-B scheme in that regard to accomplish social distancing. And then we also have been talking with people about desk screens being an easy way to add enclosure around your workplace, whether it be at your exact workstation or even sometimes, providing a range of privacy and enclosure needs in other spaces besides just your primary space, maybe even in conference. So bringing something that feels a little more temporary, if you will, from a screen perspective, but something that's portable and that you can move around with you, empowers employees to feel like they at least give a visual cue to someone that they're working and that this is your personal space. So we've been having a lot of conversations around that.
Okay, thank you. All right, so really last question goes to Ginny, and to kind of wrap up talking about spaces. Capital One obviously is one of the bigger groups here, certainly has a lot of common space, food service, things like that. So the question is, I know that you aren't planning to have your teams return until Labor Day, so you have a little time to figure out some details. I'm curious to know what your preliminary ideas are around three specific areas: fitness centers, food service, and large-scale conferencing, probably 100 people or more. So if you could talk to that, Jenny.
Yeah, right now, essential, like I said, essential associates and their essential work is being supported. And our amenities team has done an amazing job of standing up an amenities at home program that includes fitness, different fitness opportunities, different recipes and things to do, art inspiration, etc. So as we look towards re-entry, we're gonna need to prioritize the workspace over amenities at first. Those workspaces include meeting rooms, and we'll be reducing capacities and continuing to support virtual collaboration. Within our food service, we're looking at and supporting these new cleanliness concerns, and as well as reduced capacities within our large food service areas. So it's evolving with that approach, and you know, right now looking at how do we provide grab and go as opposed to buffet styles of serving and eating. Again, we're used to having a large capacity of associates on campus, and right now we're at or below 5%. So we have a lot of less of a demand for these types of services right now.
All right, well, so I think that wraps it up. That covers most of the questions. And if we didn't get to an individual question, we felt like maybe we covered it. There's a lot of duplication. We covered it in one of the others. So thank you for tuning in. I think we will continue to follow up on this subject with the panel. I encourage you to follow up with the individual panelists if you've got questions. I think everyone is developing some collateral and protocols individual to their own companies and clients, and some of that they may be willing to share. So I think we are sharing everyone's contact info who joined the webinar, so feel free to reach out to them, and we'll see you next time. Thank you, guys.
Spencer. Thank you.